Erythrocytes is the topic of this screencast. You may find information on erythrocytes in Chapter 10 of your textbook. This screencast was designed to achieve the following objectives. Describe the anatomy of an erythrocyte and how it relates to its function. Describe erythropoiesis and the life cycle of an erythrocyte. Describe the condition called jaundice. Explain how erythropoiesis is controlled, and describe anemia and polycythemia, including causes and the effects on the hematocrit. Erythrocytes, or red blood cells, function as oxygen carriers. They carry oxygen. That's their function. And when you look at the red blood cell's anatomy, you see this perfect example of the relationship between form and function, or anatomy and physiology. Red blood cells are thin and they're biconcave, that is, concave on both sides. This provides a very large surface area for the diffusion of oxygen into and out of the red blood cell. Because red blood cells are thin, oxygen doesn't have very far to travel as it diffuses into the red blood cells to bind to hemoglobin, or as it diffuses out of the cell. A mature red blood cell is essentially a bag of hemoglobin. It contains no nucleus and very few organelles to provide maximum space for hemoglobin. Again, the red blood cell is a perfect example of how form is related to function, or how anatomy is related to physiology. The cytoplasm, since there are few organelles and no nucleus, is filled to the brink with hemoglobin molecules, roughly 250 million in fact. Each hemoglobin molecule is composed of 4 chains or globins, which are shown in this illustration at the bottom of your screen. Each globin has an iron-containing component called a heme, and this is where a molecule of oxygen reversibly binds. So for every molecule of hemoglobin, 4 oxygen molecules can bind. Therefore, a red blood cell can carry 1 billion molecules of oxygen. I want to go back to the fact that a red blood cell does not contain a nucleus and contains few organelles. The consequence of that is that the red blood cell can make few proteins because there's no DNA to use for transcription and translation. There are no ribosomes, no mitochondria, no rough endoplasmic reticulum. So the cell makes few proteins. Therefore, it cannot repair itself if it is damaged. Therefore, red blood cells have a relatively short lifespan, only living 110 to around 120 days. Also, because there are no mitochondria, the red blood cells do not produce energy by aerobic respiration. There's only a small amount of energy produced by anaerobic respiration. And that makes sense. If the function of the red blood cell is to carry oxygen from the lungs to the tissues, you don't want the red blood cell itself to use up the oxygen that it is transporting. Since red blood cells have such a short lifespan, new red blood cells are constantly being formed. This process, called erythropoiesis, occurs in the red bone marrow. Erythrocytes are formed from myeloid stem cells. Let's discuss in some detail the life cycle of an erythrocyte. So, erythropoiesis is the production of red blood cells that occurs in the bone marrow. Various nutrients are needed for erythropoiesis, but the two that I highlight here are iron and vitamin B12. And I call your attention to those nutrients because Those are the most common deficiencies that lead to a reduction in erythropoiesis. As a red blood cell matures or gets close to maturity, it ejects its nucleus and becomes a reticulocyte. It's called a reticulocyte due to the network of ribosomes that's found in the cytoplasm. Those ribosomes are busy producing hemoglobin. Within 2 days after a reticulocyte enters the bloodstream, it ejects most of the remaining organelles and becomes a mature red blood cell. Red blood cells, over time, due to their high velocity journey through the bloodstream, are beaten and battered, and without the ability to repair themselves, these cells die within about 120 days, and they're disposed of by macrophages in the spleen, the liver, and the bone marrow. The iron component of heme is transported to storage sites in the bone marrow, liver, and spleen for recycling and incorporation into new hemoglobin molecules. The non-heme components are metabolized to a substance called bilirubin, and bilirubin is removed from the blood, incorporated into bile, and then secreted into the intestines to be incorporated and expelled by the feces. This figure from your book illustrates the life cycle of an erythrocyte. Erythropoiesis occurs in the red bone marrow of bone. Certain nutrients are needed for erythropoiesis. When a red blood cell is close to maturity, it ejects its nucleus and many of its organelles and emerges from the red bone marrow as a reticulocyte. Within a couple of days, the reticulocyte ejects the remainder of its organelles and becomes a mature erythrocyte. In about 120 days, the red blood cell is battered and damaged and dies, and it is phagocytized by a macrophage. It's digested and broken down. The amino acid components of hemoglobin and other portions of the cell are recycled to be used to make more hemoglobin. The heme component is broken down and the iron is stored in the spleen and liver and bone marrow. The non-iron component of heme is converted to bilirubin. Bilirubin is removed from the blood by the liver and then incorporated into bile, which is excreted into the intestine to be excreted along with the feces. If, for whatever reason, the liver is unable to remove bilirubin from the blood as quickly as it is produced, bilirubin levels will rise. Because bilirubin is a bright yellow substance, the skin will take on a yellowish tone, which is very obvious in a fair-skinned individual. And this condition is called jaundice. In an individual with a darker complexion of skin, jaundice would be obvious by looking at the whites of the eye or observing the fingernails. So, how is erythropoiesis controlled, or what stimulates the red bone marrow to produce more red blood cells? Well, if you remember when we looked at white blood cells, cytokines released by other white blood cells stimulated the red bone marrow to produce more white blood cells. With respect to red blood cells, if there is a drop in the oxygen content of the blood, this could be due to someone moving to a higher altitude, or if there's some type of respiratory illness where the lungs aren't functioning normally, if someone loses a lot of blood, either due to hemorrhage or someone donates a pint of blood, this drop in oxygen content or hypoxia stimulates the kidney to release a hormone called erythropoietin. That erythropoietin targets the red bone marrow and causes an increase in the production of red blood cells. With this increase in the production of red blood cells, there's now more hemoglobin and now a greater oxygen carrying capacity of the blood. If oxygen levels in the blood rise back to normal levels, then that will stop further production of erythropoietin. This is a classic negative feedback mechanism. Because oxygen binds to hemoglobin, the hemoglobin content of blood determines the oxygen carrying capacity of blood. Men in general have a higher oxygen carrying capacity relative to women because men tend to have a higher hemoglobin content of their blood. And this is reflected in the hematocrit, or the percentage of red blood cells found in whole blood. Men tend to have a higher hematocrit relative to women. So what if there is a below normal level of hemoglobin in the blood and therefore a reduction in the oxygen carrying capacity of the blood? This is called anemia, and it can result from the following conditions. You can have a low red blood cell count, where they're just a lower than normal level of red blood cells in whole blood. You can have a situation where the erythrocytes are abnormally small and therefore don't hold as much hemoglobin or oxygen as a normally sized erythrocyte. Or you can have a situation where you have normal levels of red blood cells, normal sized red blood cells, but the concentration of hemoglobin is abnormally low. Individuals with anemia are at an increased risk of infection because the cells of the body aren't being supplied with enough oxygen for normal functioning, and this includes the white blood cells. An individual may tire easily and not be able to think clearly, again, due to the lack of oxygen. The central nervous system requires a lot of energy and therefore requires a lot of oxygen. And most of the energy that is used by the cells of the nervous system is produced by aerobic respiration, if you recall. In severe cases of anemia, an individual may be short of breath with an elevated heart rate and blood pressure as the heart and lungs try to compensate for the decreased oxygen carrying capacity of the blood. It is important to understand that anemia is not a disease. It is a sign of a deficiency or abnormality or disease state in the body. For example, hemolytic anemia results from the abnormally rapid destruction of red blood cells. For example, this happens in malaria as the plasmodium, that's the protozoan that causes malaria, rapidly destroys red blood cells. In sickle cell anemia, the abnormally shaped or sickled cells, red blood cells, have a very short lifespan. They are destroyed very readily by macrophages. In hemorrhagic anemia, the individual loses a lot of blood through bleeding, and they lose red blood cells, faster than the red blood cells can be replaced. Therefore, there's a drop in the hemoglobin content and oxygen capacity of their blood. Production failure anemia is impairment in the production of new red blood cells due to some raw material that is needed for the production of red blood cells. It could be a deficiency of iron. That's the more common cause of production failure anemia, although other deficiencies such as a deficiency in vitamin B12 or folic acid can also cause production failure anemia. Polycythemia can be thought of as the opposite of anemia. Here there are above normal levels of red blood cells or an elevated hematocrit. This can be due simply to dehydration, where there is a reduction in the plasma volume, therefore an elevated hematocrit results. It can be a normal adaptation to living conditions. For example, someone who lives at high altitudes where the partial pressure of oxygen is lower will have a higher than quote-unquote normal hematocrit compared to, say, someone living in Madison, Wisconsin. However, this elevation in hematocrit would be quite normal for someone living at a high altitude, say in Denver. If an individual has a respiratory illness like chronic bronchitis, emphysema, any kind of illness that reduces the ability of the lungs to oxygenate the blood, would have a elevated hematocrit as well, as the body is trying to compensate for the decreased efficiency or ability of the lungs to oxygenate the blood. And of course, if there is cancer of the bone marrow, there can be a overproduction of red blood cells by the bone marrow. This figure taken from your book shows a normal hematocrit on the left, where 45% of whole blood volume is represented by red blood cells. In the center, we see an individual who has anemia, where there's a reduction below normal in the red blood cell count or hematocrit. And on the right, we see an individual with polycythemia, where there is an elevation in the hematocrit. I am not interested in you knowing the difference between absolute polycythemia and relative polycythemia, just as long as you know that polycythemia is an elevation in the hematocrit or red blood cell count of the blood. I want to stress that that anemia or polycythemia is not a disease. It is simply a sign that can be used to diagnose a disease or disorder. This screencast was designed to achieve the following objectives: describe the anatomy of an erythrocyte and how it relates to its function, describe erythropoiesis and the life cycle of an erythrocyte, describe the condition called jaundice, explain how erythropoiesis is controlled, describe anemia and polycythemia, including causes and the effects on the hematocrit. The next screencast will discuss leukocytes.